Most diabetics focus on cutting carbs, taking meds, and tracking blood sugar. But there's one major thing they overlook: minerals. These nutrients keep insulin working, protect nerves, and prevent complications. The problem? Most diabetics are low on key minerals that affect their diabetes health. And if you're missing them, managing diabetes gets a lot harder. Today, we're breaking down the top 3 minerals every diabetic needs. If you're always tired, dealing with body pain, or struggling to control blood sugar, this video can be a real help for you. Stick around, because I'll also share the best foods and supplements to make sure you're getting enough. Let's get into it. 1. Magnesium. Magnesium is one of those minerals you don't think about until it starts running low. And for diabetics, that happens more often than you'd expect. Every time your blood sugar is high, your kidneys work overtime to flush it out, but in the process, they also get rid of a lot of magnesium. Over time, this constant loss leaves you depleted, making it harder to keep blood sugar stable. And here's where things get worse. Low magnesium makes your body more insulin resistant. That means blood sugar stays high, which causes even more magnesium loss. It's a vicious cycle, and most people don't even realize it's happening. The tricky part is that magnesium deficiency looks a lot like everyday problems, and it's easy to miss. Muscle cramps and twitching, especially in the legs and feet, are common because magnesium helps muscles relax. If you feel exhausted all the time, even after sleeping well, that's another clue. Magnesium is key for producing ATP, the energy your cells rely on. Nerve issues like tingling, numbness, or burning sensations can get worse with low magnesium. If you've been feeling anxious or struggling to sleep, magnesium might be the missing link. It helps calm the nervous system, so when levels drop, stress hormones take over. Even irregular heartbeats or palpitations can be a sign, since magnesium helps heart muscle contractions. Low magnesium doesn't just cause annoying symptoms, it damages multiple systems in your body. Fertility takes a hit in both men and women. In men, low magnesium reduces testosterone and weakens sperm, making conception harder. In women, it throws off menstrual cycles and raises pregnancy risks. Libido also drops because magnesium helps regulate hormones and blood flow. The nervous system is one of the hardest hit. Without enough magnesium, nerve pain worsens, sensitivity increases, and nerve repair slows down. Your kidneys also suffer because magnesium prevents calcium buildup, and low levels make kidney stones more likely. Eye health declines because magnesium keeps blood vessels flexible. When it's low, oxidative stress rises, increasing the risk of diabetic retinopathy. The heart and blood vessels take the biggest hit. Magnesium keeps blood pressure in check, prevents artery stiffness, and reduces inflammation. Without it, blood vessels may tighten, blood pressure spikes, and the risk of heart attacks and strokes goes up. At the cellular level, magnesium is what helps insulin do its job. It helps activate insulin receptors so glucose can actually enter your cells. When magnesium is low, your cells don't respond to insulin as they should. Magnesium helps produce ATP, the fuel that powers your cells, but low magnesium leaves you feeling drained. Magnesium keeps calcium in check inside cells, but when it's low, calcium builds up where it shouldn't, causing muscle stiffness, inflammation, and oxidative damage. The good news? You can fix magnesium deficiency with the right foods. Pumpkin seeds are one of the best sources. Just 1 ounce, 28G, gives you 40% of what you need daily. Cooked spinach is another powerhouse, with 1 cup providing about 38%. Almonds make a great snack, giving around 27% per ounce. Dark chocolate isn't just a guilty pleasure. It's actually rich in magnesium, with a 1 ounce serving providing 24%. Avocados are another easy way to get more magnesium, giving you about 15% of your daily needs per medium-sized fruit. These foods don't just help with magnesium. They also support blood sugar control and overall health. If you want something more gourmet, there are plenty of high magnesium dishes that fit the bill. A Japanese miso-glazed salmon with sesame spinach delivers over 60% of your daily magnesium needs while loading you up on omega-3s for heart health. A French almond-crusted halibut with sautéed Swiss chard provides around 50% of your daily magnesium requirements and supports insulin function. And if you're craving something indulgent, A black truffle in dark chocolate mousse gives you over 40% of daily magnesium needs while satisfying your sweet tooth. For those who need an extra boost, supplements can help, but not all of them absorb well. Magnesium glycinate is one of the best options because it's easy to absorb and doesn't cause stomach issues. Thorne Magnesium Bisglycinate provides 200 milligrams per capsule and is great for nerve function and muscle relaxation. Another solid choice is Doctor's Best High Absorption Magnesium, which also gives 200 milligrams per tablet in a chelated form for better uptake. These are far better than magnesium oxide, which barely absorbs and can cause digestive problems. But here's the thing. You also need to avoid foods and habits that drain magnesium. White bread, pasta, and processed grains have been stripped of magnesium, so they don't help at all. Too much sugar makes the body lose even more magnesium because insulin spikes cause the kidneys to flush it out. Caffeine, especially from energy drinks and sodas, blocks magnesium absorption. Alcohol is another big problem. It depletes magnesium and interferes with how your body uses it. Even excessive calcium intake, especially from supplements, competes with magnesium for absorption, making deficiency worse. So if you've been feeling drained, struggling with muscle cramps, noticing more nerve pain, or dealing with blood sugar swings, fixing a magnesium deficiency could be the missing piece.